Thank you, everyone, for joining us for today's Facebook and YouTube and TV live question and answer session that the County Board and my colleague and I, Takis Karantonis, will lead. We've been doing these for about 5 months, town halls where you get to ask questions directly of our experts and the County Board. We want to spend a little time today focusing on the current status of COVID-19 in Arlington. It's important to remember that even though Virginia has lessened restrictions on gatherings, it doesn't mean that Arlingtonians should be relaxing behaviors we know will prevent the spread of this deadly virus. Things like staying home, keeping 6-foot distances or more when going outside for essential needs, and wearing face coverings. Public health continues to work with our community to stress the importance of these personal behaviors, given community spread is still in Arlington and in the Northern Virginia region. We know and we're seeing people want to do things like go out to a restaurant or certainly go on vacation. While Virginia has lifted restrictions to allow for some of that to happen, COVID-19 isn't going away anytime soon as the ongoing cases continue to show. We need to work together. Our residents and all of our community must remain committed to preventing the spread of the COVID-19 virus. For our discussion today, we also have several members of our county's executive leadership team with us. Deputy County Manager Jim Schwartz, Dr. Aaron Miller, Director of Emergency Management, and Dr. Ruben Varghese, Director of Public Health, as well as Captain Mike Rowling from the Police Department. Before we get started, let's share a few highlights, and I'll send it to you, Takis, to give us a little bit of an update.
Thank you, Matt, and I'm excited to be here. I hope this has been a very helpful institution now for 5 months. It's a good thing to have a direct way for a Q&A session every week. So we have been in phase 3 now for over a month. Here in Arlington, we have seen a slight uptick in daily cases, similar to the increase that we saw at the end of June and beginning of July. So we are following this increase in reported cases very closely, but only time will tell if it will continue to rise. We will hear more from Dr. Varghese and our public health director shortly, as you mentioned, Matt. So something I wanted to say, testing sites. We have a drive-through testing site on Quincy Street. A reminder to everybody, drive-through testing site on Quincy Street in partnership with Quest Diagnostics, and a walk-up site at Arlington Mill, which we run in partnership with the Arlington Free Clinic. Both are continuing to serve our residents. There are also other locations, and I will refer to them a little bit later. We're actively removing barriers that may have hindered access to these sites before. So this includes offering in the Quincy Street site, in the drive-through site, no appointment required tests. But you have to have a referral, which you can obtain through telemedicine or phone consults, so you don't actually have to go into an office to get your referral. We are waiving, though, physician referrals for our walk-up site at Arlington Mill, which is primarily aimed to serve our uninsured and underinsured residents. And this we are running with in partnership with the Arlington Free Clinic, which we all want to thank for their engagement with us on that. Still, we have a COVID website, a landing site, and it's arlingtonva.us/COVID-19. This is our main website, and this is where you can find all information you need, including more testing sites for you. So there are also other good things that have been taking place to support residents and businesses during these very difficult months. The We Are Covered program. So to date, this is a program that's helping everybody to comply with the Virginia's requirement for face coverings, for masks in public buildings. So about 320 businesses, multifamily properties, and religious organizations have already signed on for that. So we encourage all other multifamily buildings and faith organizations and businesses to join in this effort. It's really very important. Restaurant outdoor seating, as most of us have noticed, we have already 71 places that have been approved across the county. We received a total of 106 applications for this, what's called temporary outdoor seating areas, which helps restaurants to reopen and expand their outdoor space, and at the same time being very safe for their patrons. We also helps businesses directly. $2,675,000 are already out of the door to help 388. That's the exact number of small businesses in Arlington, which got this money through the Business Emergency Grant Program. Actually, the acronym is Giving Resiliency Assets Near-Term Grant. This program has been providing financial assistance to Arlington small businesses that have been impacted by COVID-19. So this is an awesome result. A total of $2.8 million have been allocated. Matt, what am I forgetting from my account of what's going on right now?
Matt, you're on mute.
I have one additional update that I know will make you particularly happy, Takis, as well as everyone watching this call. And that is, I just received a legal document by the Supreme Court of Virginia that stays evictions until September the 7th. And so many have been working on that issue. That is, evictions that are based on failure to pay rent due to COVID will not move forward until after September 7th. Now, there are other evictions. If you are unsafe in your apartment, those can move forward. But certainly failure to pay rent, that's a great update. There's also, we have been working on this far before the Supreme Court's order today, and that is the state has provided $450,000 to help Arlington residents who have lost income due to COVID-19 pandemic pay with their rent or mortgage. So we have been helping a lot of people through Arlington Thrive, through our Department of Human Services, and we're very grateful for both of their work in particular. The funding can be a lifeline for many Arlingtonians who lost their jobs months ago and have yet to see those jobs come back. You are on our minds, and you are a lot of our focus. The funding, the $450,000, is retroactive to March 1st, and will extend through the end of 2020. So we have those resources to help. Any Arlington resident who believes they may qualify should call the Department of Human Services, DHS, at 703-228-1300 for more information. This $450,000 is part of more than $3 million the county has used thus far to stabilize housing for our neighbors in need. So let's get to the questions. As a reminder, you can submit comments in the Facebook chat. Participants can also text their questions to 571-348-3053. That's 571-348-3053. And we'll do our best to get to as many questions as possible. We'll start with the science and with our Director of Public Health, Dr. Varghese. First question we have is on the public health metrics now that we're in phase 3. Can you tell us a little bit of how we're doing, Dr. Varghese?
Sure. Thank you, Mr. DiFerranti. They always say a picture's worth 1,000 words, so I was thinking that I would share my screen if I can. All right. The new Teams has changed its format, but we will overcome this. And let's see if I'm showing the right one. It's taking time. Okay. It's almost the right one, but we'll go with it. So what people are seeing here is a graphic which I hope will illustrate the case experience, what it's been in Arlington. So this is on the y-axis is the number of cases. And on the x-axis, we first have starting since March when the cases began in Arlington. And then the numbers right above the months are the week numbers that we get, we report the data to CDC so that you're oriented to that. And then the various colored graphs, lines are the ages of groups. So the purple line is those under 18. The red line is those 18 to 29 years of age. The green line are for those who are 30 to 39 years, the gold line 40 to 64, and the blue line 65 and older. And I think what you can first of all see is that overall there was a peak in the April-May time for all of these. In a sense, that's our largest peak. We've also subsequently seen a peak starting in July. And let me break this down for you. First of all, one of the things that on this slide we didn't put in, phase 0 began at the end, somewhere at the middle of March, which would be between weeks 12 and 13. And that was when the Commonwealth and the governor saw that cases were happening and trying to prevent the explosion. But if you already have had transmission, it takes a while for that sort of transmission to stop. The area where it says phase 1, 529, that happened in week 22 of the year. And that's when we went back from phase 0, where nothing under 10, no one under 10 people could gather. At week 22, you saw that you could actually start having groups of 10 or under gathered together. And the lines continue to go down. Week 24, which is when phase 2 began, was when those who you could have up to 50 people gathering. The lines continue to go down, hoping that people did the right thing. By the time we got to week 27, which was July 7th, right before the holiday, you see that there's been an increase since that time. And this was where we had groups gathering 250 or more. So, well, I can't say correlation means causation, some people say. I can also tell you that it's really hard to have causation without some degree of correlation. And this is why the public health message is we're aware of this trend, and there have been times where it's been going up and down, and I hope, Mr. DiFerranti, that we're going to see it go back down. But we need to realize that when we gather together, we can actually have germ transmission. And I've been saying, and you all have it, we still have community spread in this community. And that means the germ is widespread, maybe not as widespread in April and May, but I can't find the single source or the few sources of it. And that's the definition of community-wide transmission in the layman's terms. And so what I want people to remember is we're going to continue to monitor this. But that's why it's important to remember that even though Virginia has lessened restrictions on gathering, it doesn't mean Arlingtonians should be relaxing behaviors we know will prevent the spread of COVID-19 virus. So I may be a broken record on this, but things like staying home is the preferred option if you can, keeping 6-foot distances or more when venturing out for essential needs, and wearing face coverings in those spaces. We continue to work with the community to stress the importance of abiding by these personal behaviors, given the community spread. We know and we're seeing people want to do things, as you've mentioned, like going to a restaurant or on vacation. And so just reiterating, COVID is not going away despite the fact that the restrictions have been lifted. So I'm just so happy our residents have been cooperative, and I want them to remain committed to preventing the spread of COVID-19 virus. So that's where I'm going to leave the data. If you have specific questions, I'm happy to go into more detail.
Sure. Thank you, Dr. Varghese. I did just want to mention one item that is a concern to us. In that graph, there's a red line that covers 18 to 29-year-olds, and there is a slight uptick. And many who watch this might look at the daily cases And we have not seen the growth, the just terrifying growth that you see in California, Texas, Florida, and Arizona. But I think you've talked about, Dr. Varghese, how once there's even a slight uptick, it can be very, very hard to slow the increase in the spread of the virus. So this is a little bit of why, at least from my perspective, and I believe the board as a whole really, we are very concerned about any increase in the single number of cases, and particularly want to make sure that our younger residents are really being disciplined and being careful. So I don't know if you did, it's not, the trend doesn't stop necessarily, but I wondered if you wanted to comment a little bit about that slight uptick in that red line, just a bit.
Sure. Thank you for that opportunity to point out some of the specifics on ages. So before I get to the red line, it's not surprising that this was a problem initially for people who were in 40 to 64 and 65 and older. In fact, the first peak you can see happened back in April among those who were 65 and older. Probably a lot related to the long-term care facilities and the fact that older individuals have comorbidities that put them at risk. You start seeing probably with essential workers and other activities, 40 to 64-year-olds. Each age group, there's been a bump. You saw the 30 to 39-year-old group, then followed by the 18 to 29-year-old group. After the reopenings, the first two phases, all of the lines were going down. All of the three major groups have had an increase. So to be fair, the 30 to 39-year-old group after the phase 3 reopening July 1 has gone up. The 40 to 64-year-old group, there's been a similar increase, but the greatest increase has actually also been between those for ages 18 to 29. So this all is real. There's been an increase, and to your point, exponential growth, once it starts, it takes a longer time to also come back down, which is why the more we adhere to all of these behaviors, we're trying to keep it at this level here until vaccine can come along to hopefully save us from having to continue to do this. And that is why, as you said, we don't want this curve to get any higher. But whatever's happened here has planted the seeds for the areas that we don't have the data yet. And that's often because it takes a delay in reporting, and we don't want to wait till we get the reports to show we're actually in a worse place.
Sure. Well, thank you. That's very helpful. And that leads right into our next big question. The board passed a new ordinance to address some of the issues that we just talked about. And we want to turn to our representative from the police department, Captain Rowling, to share more about the new ordinance on physical distancing and streets. And that's that question also involves, for sure, the issue of the work we've done on the Arlington Restaurant Initiative. So maybe Captain Rowling could start with the Arlington Restaurant Initiative and then talk a little bit about the board's action and the police department's work.
Sure. Thank you, Mr. DeFerranti. So the Arlington Restaurant Initiative, ARI, started about 3.5 years ago. Basically what it is, it's a partnership with all our restaurants and our business community with the police department, where we share ideas, we work together hand in hand in order to best interests of each other. So the police department and the county, we work together with other agencies such as the Fire Marshal's Office, Arlington Economic Development, ABC, Public Health, and we formed a task force, and we go out and we work together collectively with these restaurants and businesses to find out what their needs are. And we try to share ideas and work together in order to make sure that the businesses can thrive and do things in a safe and efficient manner. Especially with COVID and what's going on right now, we're trying to really do everything we can using social media and other networks and other avenues, such as this forum here, in reference to get the message out. Okay, this is what we are looking for. This is what the county expectations are. What can we do to help each other to thrive and make sure that businesses can continue to operate in a safe and efficient manner? With that, the county board, as you mentioned, sir, passed the county ordinance in reference to trying to combat what the doctor was just going over. In reference to that, just to kind of give a summary of what that is that unfortunately some people are not adhering to state and county policies and practices. So including wearing face masks inside public buildings or practicing social distancing, thereby creating the potential for public health, illness, and/or death. As was mentioned, this seems to be especially while people are waiting in lines, as that's why this ordinance seemed to be passed. So the ordinance states, just so people understand, that pedestrians shall obey signs and other signals erected on highways, streets, sidewalks, and public spaces adjacent thereto, used by pedestrians, prohibiting pedestrians from congregating in groups of 4 or more than 4 persons in those places, and requiring those pedestrians to maintain a physical separation from others not less than 6 feet at all times. So basically what we're asking is that signs eventually may be posted if we cannot get this under control. And if they are posted, pedestrians are going to be limited to not gathering or congregating in more than 3 people, right? Anything that's more than 3 people that aren't spaced 6 feet apart could be in violation. Now, we hope to avoid that. We hope to avoid any type of enforcement action. That is not our goal. We would really like to keep continuing educating. Last night, our ARI team and task force went out and did education with approximately 20 restaurants and establishments and passed out flyers, and this is what the code is, and this is what we can ask of you, and what can we do for you. So we shared that information, and we continue to educate to try to get voluntary compliance and not have any type of enforcement action. Unfortunately, if we do have to take enforcement action, this could result in a citation for each individual that is in violation for up to a $100 offense. The county board has approved this ordinance to be used only if needed, and in the county's efforts to reduce transmission of COVID-19. So before any implementation, the county will provide signage and notification in advance if we're going to take any enforcement action. So there will be plenty of social media or campaigns that actually educate the community that, hey, signs are posted. The plan is to have some kind of map of where those signs may be located so people understand where to look for those. We're not out to try to get anybody. We're just trying to seek voluntary compliance, and that's our ultimate goal, trying to educate first and see if we can work together to combat this virus.
Great. Well, first, Arlington Restaurant Initiative has been nationally recognized, and that's really a credit to you, Captain Rowling, and then Officer Jim Misteris, who also works for you, and others. But this is a way that we have worked with our restaurants. Under Virginia law, it's just restaurants. We might think of them as bars, but it's technically just restaurants, or what our establishments are called. But we have worked over the past years and made things safer in general, and those relationships are critical to what we're trying to do now. We've all said it, Takis has said it, and all of the board members have said it. We would much, much prefer to get voluntary compliance with social distancing, but we're seeing long lines outside of bars and restaurants, and that is really of concern. And the graph that Dr. Parkes just showed is an example of why we are concerned. So we'll have more questions, but just a big thank you, Captain Rowling, for that background. And couple of just 2 last points. This is focused on it's a traffic infraction of a cash ticket. We are not seeking to have antagonizing or difficult conversations. We just want people to be safe, because we know that if the virus stays alive, that'll be a real And if we continue with growth, the exponential growth that Dr. Varghese was mentioning, we've got a real concern. So that's just a note about it. Implementation also wouldn't happen until after there were signs put in the situations and the specific places where broadly across the county there might be concerns near typically these restaurants in different parts of the county. So with that, let's go ahead, Takis.
Matt, I wanted to say that appealing for voluntary compliance is not equal. Doesn't say that this is not a less important or less urgent thing. Voluntary compliance is absolutely urgent. Actually, voluntary compliance is what everybody has been doing for so long. And if you have seen a positive, dipping in the numbers, it's because everybody in Arlington has been voluntarily being compliant during phase 1 and phase 2, and still have a phase 3. That is very important. And the ordinance sends also a signal that we are watching that. So government is watching that. We are really concerned. The risks and the stakes are very high for everybody. It's not only for the safety of an individual, it's the safety of the entire community. It's a public health issue. It's also very important for our economy, for the jobs, and everything else. So I believe that this should be very clear, that we take it very, very seriously. And, as you have seen in the region, things can escalate, or, we can see, more drastic measures overnight almost, if the numbers are not, if we are not going to tame these curves.
Sure. I'm glad you mentioned just how important and how critical it is that we do this. So we're on to the questions, and I'll start just with a question we got on the schools. I know there's been a lot of discussion of this, and I'll touch a little bit on it, but I also believe it would be either Jim Schwartz or Dr. Aaron Miller. The first part of it is about what the county board is doing, and then there's another question of what we are doing on the staff side to collaborate and coordinate with our schools. I'll just say that the county board is keenly aware of the strain on parents and the concerns that teachers have regarding opening schools. And we have been collaborating. One big component of this is, of course, childcare for our teachers as school opens virtually on September 8th. But this is a high priority for each of us on the board. We are collaborating. We're also mindful that we want to respect the school board's lead as well as they make the decisions with respect to instructions and opening, along, of course, with our superintendent who is communicating regularly. So that's my thoughts on the schools. Don't know, Jim or Aaron, if you had points you wanted to add with respect to collaborating in the schools.
Not a whole lot to add, Mr. DeFranti. And first, let me apologize to everybody. For some reason, my camera is not working. So I'm out here, but in voice only today. I think you largely hit on it. I would emphasize that Dr. Duran is in daily, if not multiple times a day, contact with the county manager. They are obviously collaborating, coordinating on, activities that relate to the school's operations, because we do recognize that so many families are affected by the virtual learning environment, want to get back to normal schooling as much as possible, but that's not going to be in the cards in the early portion of the school year. As far as money is concerned, we do have CARES Act money. I know the board has been briefed on that, and some will be allocated to the schools. We're still waiting for the schools to work through a little bit more of their analysis before we settle on an exact amount. But the schools will be well taken care of, to meet their needs so that they can open safely, either continuing the virtual or possibly a hybrid, or hopefully as soon as possible in a regular learning mode.
Great, thank you. And I'm glad you touched on the funding component. There has been discussion, the school board had discussion last week on that, and we have been in regular contact. Really, we want to continue to get a sense of the scale and scope of the need and partner with the schools to address this high priority. Schools are a key part to the heart and the center of Arlington as a community. So we on the county board are partnering on a regular basis, and also really thrilled that daily contact between Superintendent Duran and the county manager can continue. Takas, you may have, you want to take the next question, either schools or whatever subject you see next in our chat or through Facebook.
I think one important question to answer is, so there is, and I believe it has been answered many times, but it's good to reiterate. So I see here hardly anyone in Ballston is using a mask. It comes with that, and somebody else is also asking that people are biking on without wearing a mask, or not very often wearing a mask. And the bottom line of this question is, what can we do to quote unquote enforce the wearing of a mask, or to make it compulsory or not? So I would like to maybe Dr. Verghese or.
Well, I'll start, Mr. Karantonis, and anyone else can join in. We are following what actually the governor has provided in his orders, and so I think people are frustrated that there were no recommendations in most circumstances to have a requirement for face coverings in outdoor settings, because in general, the risk is lower if you're not actually congregating, as would be. Once again, the science portion of it is the closer you get indoor or outdoors, you're going to have more risk of germ transmission. But obviously, the same distances inside and outside, there's one difference. There's a philosophy or a rule of thumb that environmental services provides. The solution to pollution is dilution, and if you consider germs a form of pollution, much more easily the diffusion in the air allows you to be at the lowest risk you can compared to the same circumstance inside. So we're doing what we are within the law. Obviously, we're going to continue to encourage people when you're outside to wear face coverings if you are going to have unintended contact with folks. But I also want to reassure people, if you're passing, the risk is lower. And that's why, in the contact tracing world, we define a close contact as those who have had contact with someone within 6 feet and for 15 minutes or more. So I realize it seems like there are two different things going on, and in the public health world, we're talking about 6 foot distances and face coverings, but the governor's order is based on more than just public health.
Great. So that's helpful, and I know that Dr. Verghese, you're handling multiple different items, and so we'll have Dr. Miller also be ready to help with us as you're juggling a bunch of different things at the same time. We did get a question, Dr. Miller, that I know you follow the data, and we got a question about metrics and with respect to reopening of schools, and there's just a tiny uptick in the number of cases, but I guess the question is a little bit, if we haven't seen a significant increase in cases, this parent is writing and saying, why would we have to keep schools closed, because this is a challenge? And I know that the superintendent has thoughts on that, but also I know that you look at the data fairly carefully and wondered if you could add some insight there.
Sure. So I'll start a little bit, and if Dr. Verghese is available, he can chime in. But one of the things that I'll say is you've got to remember the public health metrics that we look at are really lagging indicators because of the way data is collected and because the way that this virus works. There's an incubation period of anywhere up to 14 days that we know someone can begin to become symptomatic and also begin to be sick within that period after exposure. And the way that the testing data and the reporting data works, it means that generally what we see is reflective of what happened, as Dr. Varghese mentioned, 2 to 3 weeks prior in those timeframes when he was going through that graph with us earlier. And so yes, we see these slight upticks because we do have some changes and obviously have ups and downs, but stay rather level. The titration that Dr. Varghese has talked about is what's very important in this. And we know that making significant adjustments, such as reopening schools, such as reopening places of business in allowing large gatherings, can have a significant impact. And so not only in the public health guidance that I know he provides, but in our side in looking at things like testing, hospital capacity, and the ability of our medical system to handle intense cases. There are a lot of variables that go into this, and the advice that we give involves looking at a wealth of those, not only with Arlington, but within the region. Ruben?
Sure. Thank you, Aaron. I think what people also need to realize is that there isn't a one-size-fits-all approach to this decision making. So I know people have asked the question, for example, the county may make certain decisions and it may be different from the decisions that, say, perhaps a business or the school system may need to make. Each has a different set of risk factors, I think, that they have to be considering. So Dr. Duran has to think about not only the health issues, staffing issues, and the picture for the welfare of children and parents and so on. So those are not the same equation for all comers. So I think we need to extend some grace to folks in saying they're making a decision with the best information they have at that moment. We do work with the school system on that, and so, but it's not just a health decision that they're necessarily basing all of these decisions on, as I understand it.
Sure. Well, thank you very much, both of you. If folks have concerns, there's certainly, if you look at Israel's experience with respect to when they opened schools, that is certainly relevant, as Superintendent Duran and the school board work together to make that decision. So we are very conscious that students most in need, low-income students and students with special learning needs need instruction. We're also very mindful of the parents, many parents who have expressed to us how hard this is. So those are some of the factors that try to answer the questions on schools and childcare, where we know we have to provide childcare for some of our teachers and county employees, but if you don't do it for teachers, we can't get there. So we're working away on it. Takas, over to you for next questions. I think you're on mute.
I was mute. Apologize for that. So zip code 22204 has the highest number of cases. What is county doing to assist and test this population?
Sure. I think this one would be for me. I think as a reminder, the reason why the county partnered with Virginia Department of Health and the Arlington Free Clinic to offer the testing site at the Arlington Mill site, which is in the 22204 area, it provided us with a county building where it would be in the heart of a large portion of where our cases are coming from. And we have seen an increased use of that facility by the folks in the 22204 zip code. Obviously, the more we can increase access, the better. But that was the impetus, and we've been seeing a steady increase in the number of people coming. And because it's through the Virginia Department of Health offices, we've been doing it as a community event, and we've been doing both symptomatic and asymptomatic individuals, because in areas with that sort of concentration for people who are low income, without insurance or underinsured, we're trying to control the virus. And obviously we're going to be looking for more ways to partner as needed in other parts of the community if our testing resources allow.
And I would add to that that other programs that economically support these. Many of our fellow citizens are long to 204, many of whom are experiencing unemployment right now, and really tough times. We are really very concerned about the lapsing of federal help here, but still we have appropriated money and with the help of many nonprofits, especially Arlington Thrive, we are assisting these households with rent assistance, food assistance, well, most importantly. So we are continuously focusing on how to comprehensively adjust to the challenges of this crisis. Still a lot to do, but we are on it. We are really doing that.
Great. So we've gotten a couple of other questions. One, a question about what protection do homeowners have if a tenant can't pay their rent? And there are some federal protections. We can also put in the chat or available through Facebook the link to the eviction moratorium, which will help tenants. There are also protections for landlords in federal law, and we're just mindful that it's a challenging moment for both homeowners and landlords as well as tenants. And tenants really have been in fact, the focus of a lot of the work that we've done. For specific data on our cases, we have a new tool that we're now using on our COVID-19 page that includes zip code-based data and also the other needs that are there. There's a question with respect to bars and restaurants, and I think this would be, and why, this is partly county board point, but I think probably also maybe Jim Schwartz, you might have thoughts on this as well, but why haven't we done more to seek to try to keep people from congregating in bars and restaurants? And there is a governor's order on that issue, and we have been seeking to stay as a region in line with our adjoining regions, even as we are concerned. But I don't know if you want to talk at all about phase 3, Jim.
Well, just briefly, Mr. DiFerenti, in phase 3, restaurants are allowed to be open with indoor dining at 50% of their normal capacity, and while maintaining 6-foot distances between dining tables. Bars are not supposed to be open except as pass-through areas, but they can be used for seated occupants. But there isn't supposed to be people standing at bars the way that we normally envision that kind of activity going on. As Captain Rowling mentioned earlier, the Arlington Restaurant Initiative, our cross-departmental teams are out there trying to educate not just the restaurants, who are great partners with us in these kinds of endeavors, but also taking the opportunity to let the public outside the restaurants know that social distancing and mask wearing still becomes important. In the restaurant initiative and combined with the governor's orders, our public health department does have the ability to cite restaurants, and this is on the interior of a restaurant. This is inside where that activity is going on. If they are not maintaining adherence to the governor's order under phase 3, then obviously they'll be instructed to do so. We're not looking to jump automatically to cite people, but that could be a consequence of restaurants that are not complying with the phase 3 order. So we do have people out there. Again, as Captain Rowling mentioned, we're trying to do this, based on education and cajoling, people to do the right thing. But we do have a little bit of power when it comes to inside the restaurant, and that power is vested with our public health department.
Great. Thank you, Jim, for covering that piece of it. And it is the public health department and our police. We have been stepping up enforcement as we seek to gain compliance, which is so important, but to do so in a way that is getting people to see the right thing and then do it, and not an easy task. Did want to just check, Captain Rowling, I know if there's anything you wanted to add with respect to, the work that you're doing to partner with public health, and also some of the challenges of how you're seeking to serve the community and also keep people safe. Don't know if you have any brief thoughts on that. Not an easy thing to do.
Yeah, as mentioned before, we are working with them hand to hand pretty much on a daily basis. So we have a lot of resources out there. We put together guides for the business community and the restaurants in order to provide best practices and how they can move forward and open safely. And we continue to go out and educate. And we passed out flyers, like I mentioned last night. We did it again last week, and we're going to do it again next week. And we're going to keep educating the best we can to try to make sure that we get this voluntary compliance. So hopefully we get to the point where we never have to take any type of enforcement action, to even include putting signs up. Because if we have to put the signs up, that means that maybe we're just not getting to the point where we need to be. So we'll keep working with them day in and day out. They have all our contact information, and we'll continue to work together collaboratively to make sure that we can do this the best way we can.
Sure, really appreciate it. Not easy work, but very important. And so we also, I know, Takis, thank you, Captain Rowling. I think, Takis, you might wanted to make a little point about the process for we are going to look at it again in September, the ordinance. Go ahead.
And actually, we have also a question from somebody, I think, on Facebook. How is the board using their advisors, board-appointed advisory commissions in pandemic response? How not just helping with food distribution, but related to their advisor areas of expertise, and so as the cases evolve, as the day-to-day monitoring of the situation goes, the board will have to take we'll have to make decisions and react fast and make sure that we respond. But all these decisions, most of them, and in this case, this ordinance, will come back to the regular board meeting in September, which means that the commissions that are involved here will be consulted, and there will be ample room for comment, for public input, and also with regards to other long-term. This pandemic is with us unfortunately, for the long haul. Therefore, as our commissions are reopening and we are getting back into our, with electronic means and safely into a way to provide this public input, this is really very important and very, very necessary for us. So we will be talking a lot about the details and about how best we roll out, these measures and other policies that relate to the response we have to the COVID-19 pandemic.
Great, thank you. I think it's important. We are going to be listening and engaging over the coming weeks on this for certain. Question, Dr. Miller, question about testing and how long it currently is taking to receive results, and then to start contact tracing. We often get these questions. So.
Sure, yeah. So I saw that there was a response in the chat box, which is great. But for our sites, because those are the ones that we have the data on, obviously in partnership with Quest and the North Quincy site, and then relying on the Virginia Department of Health Laboratory Services in partnership with the Arlington Free Clinic at our Arlington Mill site, we're seeing turnaround times on average between 3 and 5 days. Those are significantly better than some of the other turnaround times that we see. And the reason for that is because we have been able to establish individuals going to those sites as having a higher priority because they have a doctor's screening and referral, and because we're using the state testing system at Arlington Mill and using Quest as a national lab provider. So we're able to sort of increase the priority for those individuals visiting those sites to ensure that they have a faster turnaround. I did see a question about pooled testing and some of those other things. The Virginia Department of Health and the Division of Consolidated Laboratory Services, DCLS, administers the state's testing protocols and state testing procedures. We at the local level have asked through our health district as well as our public health and emergency management partners that the Commonwealth consider things like pooled testing, using more high throughput and high availability labs in order to increase capacity. There are a significant number of things that go along with that, and Dr. Varghese can talk specifically more about them. But we have put forth those requests, and we are, following the guidelines set forth by VDH.
So I'd be happy to finish up there. Thanks, Aaron. What people need to realize is we recognize testing is important, but without a national strategy and given how big the pandemic is, we have to realize there has actually been issues as simple as supply chain. People aren't aware, but like the nasal swabs aren't necessarily, you're not using Q-tips. You have to actually have specialized material to collect that, and you have to have the capacity somewhere in the world, if it's not in the U.S., to produce enough for that to arrive places. And so there are supply chain issues for things like that. There are supply chain issues on the reagents that are used, the chemicals to detect the virus in the laboratories. So it is not as simple as just saying stand it up. If it was that plentiful, we'd love to be able to do that even here in Arlington. So I just want to remind people there's that context that we have to remember. It doesn't mean we can't do things, but testing is important, and we still need to do these other things. And I know that it sounds like a broken record, but a way to prevent exposure is to keep your distance.
Sure. Thank you, both Dr. Miller and Dr. Varghese. Really appreciate it. Takas, any other questions?
So maybe quick for Dr. Miller and Dr. Varghese. We got here a question about this app that I believe the governor mentioned a couple of days ago. Correct me if I'm wrong. COVID-Wise. What do we know about that? This is the latest. It's about tracing now, not.
Sure. So first of all, I think I want to put things in context of contact tracing and case investigation. I've seen some questions come through. And so we have an established group of individuals who are doing case investigation, talking to the cases to identify contacts, and then we talk to the contacts. If they meet our definition of close contact, under 6 feet, for 15 minutes or more with a known case, we ask them to quarantine. And actually both quarantine and isolation, which is for the sick, is voluntary, and the vast majority of people cooperate because they want to improve themselves and they don't want to infect other people. And so those are the important things, and that's happening throughout the region. The COVID-Wise app is another tool in the armamentarium to actually help those who want to consider using the app, and they can find more information on the Virginia Department of Health website. And if they register, the way it works is if they ever are identified, if we tell them they're a case and they choose to, they'll get a PIN number from, if they're an Arlingtonian, they'll get it from Arlington Public Health. They can enter it into their app, and then that information will then go to anyone that person's phone came in contact with, in a sense, through Bluetooth technology over a 14-day period before that. And it's reportedly kept in a way that the confidentiality has been otherwise maintained. That's the concept, and then people have to decide if they're comfortable with it and so on. Obviously, any or all tools are welcome, and I want to reassure people there is actually a robust system for contact tracing, and we've been fortunate. The vast majority of our folks are forthcoming with names, and the people want to actually cooperate. I don't know if, Aaron, you have anything to add.
All good.
Great. So there's a couple of questions about sidewalks and ensuring that people who are on sidewalks will wear masks, or at least be very, very careful to make sure that they're not within 6 feet and thereby infecting others. And this is a real challenge. I think all of us have seen people both running in the streets if they're jogging, so as to stay away from others, also running with masks on and biking with masks on. This is a case where, we just want to be really careful to stay distant, stay socially distant, and at least 6 feet. And that's critical. And when you're in a place where there will be a lot of foot traffic, you need to be wearing a mask. And so that's an answer to that question. The same is true for multi-unit buildings, your apartment buildings. I live in a multi-unit building, and every time I step out of my unit, I have a mask on to go down to get mail and to go in the elevators. So those are just, I think it's also important to note that we strongly encourage this, and we know there's a lot at stake, but this is something that is really going to be about working together to get responsibility and compliance rather than punitive measures. That's just it's too much in apartment buildings. So we did have one question about phase 2 and cohesion, and this is, I think probably Dr. Varghese, you might touch on this. The question is a little bit framed for the board and also for what we're doing to work with other adjoining jurisdictions. And our chair, Libby Garvey, is regularly talking with others. And I know that at every level, at public health, at the county manager, and at the board level, we're regularly trying to work in concert with the National Capital Region, as well as Alexandria and the localities in Northern Virginia. But you want to talk a little bit about that coordination, Dr. Varghese?
Sure, I'll be happy to talk about the health side, and then we'll turn it over to Dr. Miller and to Mr. Schwartz. On the health side, the health directors meet actually in Northern Virginia. The 5 health directors meet every morning at 7:30 in the morning for a half hour to 45 minutes every day, talking about any latest developments, how we're interpreting or implementing things in the region, and have actually worked with the state health department, have them on our calls if we need to discuss policy directions and things that our region needs. We also do the same at the council of government level, typically once a week, where we have some sort of discussion about what each of the health districts or in the region are doing. Obviously, one of the things that people have to remember is that when it crosses state lines, it's going to be sharing information, but we have 3 different state systems, and I think sometimes people get frustrated that if the District of Columbia can take action, it's because, well, they are a state. They are not the Northern Virginia, where we're within a Commonwealth structure and so on. So, but we are coordinating all the time, and in fact, we're meeting this Sunday to discuss things in anticipation of our NVRC discussion on Monday. So the 5 are meeting at 8 in the morning. So. Aaron, is there anything you'd like to talk about the emergency managers and what's happening in the region?
Sure, thank you. So I will say, the Northern Virginia emergency managers, as well as those within the National Capital Region, still closely coordinate on issues like hospital bed availability, watching the hospital and healthcare system status in partnership with our healthcare and hospital coalitions, coordinating on things like PPE purchases for our fire and EMS, and making sure that those levels and system abilities, we minimize the impact where we can. As a matter of fact, I'm actually supposed to be on a Northern Virginia emergency manager's call right now. I'm trying to balance between the two, like most everybody, to be able to meet those obligations, continue to cooperate with my colleagues and make sure we're doing what we can at those levels, as Ruben mentioned.
Sure. So, Jim, I bet you would say that Ruben and Aaron have covered most of it. I do know that you also have been working with the hospitals, and the county manager works with his counterparts across the region really that regional collaboration has been truly impressive. And we must say that an 8 o'clock meeting on a Sunday with Ruben, as well as juggling 2 meetings for Aaron, it's an indication we really are at the staff level as well as at the board level working to stay coordinated as we work to fight off this pandemic. So over to you, Takis.
A quick question is an important part. We almost forgot about public transportation during these COVID times. The ridership numbers on Metro and on our bus systems, ART and WMATA bus, are dramatically low. So but public transportation is still there, is still available for the many Arlingtonians who don't own a car or cannot, afford any other way to move around town. What does the question is in Arlington County working with WMATA to make sure, is Arlington County working with WMATA to make sure that Metro riders are wearing masks? Who can I contact while the violation is happening? This is very frustrating. Yes, indeed, it's very frustrating. I say that also as a user of ART. But I have to say, it is really the exception that we see somebody. I mean, for me, using the 45, 41, and 77 buses, most riders have been really compliant. They have their masks on all the time, outside and inside the bus, of course. But the question is, how can they report if a violation is happening?
Well, that's a tough one. Maybe it would be Jim. I don't know. We also have our area, our reporting tool. But Jim, we could certainly also point folks to Covid-19 website. But Jim, did you have any thoughts on that? Or maybe Aaron?
I don't have anybody specifically that they would contact. We will figure out what that is and be in contact with WMATA on our own just to see what they may be doing. I don't have good information about that. I would, though, however, echo what Mr. Carantonis said in that, we've got pretty good compliance on the ART buses, and we provide masks or face coverings for those that get on an ART bus.
Yeah.
So doing the best that we can to make it as convenient as possible for those that may be in an awkward position at any one time.
Yeah, ART has always a customer service number. It's 703-228-RIDE. So 7433, 703-228-7433. So if somebody sees something, etc. And I have to say to credit the drivers, sometimes I've been there. They had a tough time to instruct passengers that they couldn't board the bus without the mask, etc. They did the right thing, and we have to recognize them. They are frontline workers as well.
Great. Well, that's helpful. So we'll each do one more question and then we'll wrap up. Mm-hmm. Here. There are a host of questions that are related to schools and childcare, and I'll just touch a couple of them and then open the floor to Aaron, Jim, or Ruben if you have thoughts. First, we should be mindful that the county board collaborates deeply, and we think about schools on a daily basis. We also understand our role is to partner with the school board and the superintendent, who are leads. I do know that the school board has said there's teachers. I've seen teachers online giving lessons while they're taking care of their own kids. And so if you think about what we need to do to address and open schools, I know Dr. Duran and the school board is thinking about we have to make sure we address teachers' needs so that there even can be any schools open in a hybrid capacity. We heard about the emotional and social needs of children, and my goodness, my friends who have young children, that's a huge issue. We also had a question about HVAC systems and cleaning them in schools. That is a detailed question that would really be best to focus with Dr. Duran, I believe, as the chief administrative officer there. There is one area of schools that we haven't touched on that we are working several days this week, and each member of the board, and that is broadband. The county board provided $500,000 in funding to help individuals get broadband. We also have hotspots around the county at Barcroft Sports and Fitness, at the Central Library, at Columbia Pike Library parking lot. But even beyond that, we want to do more because we know that having the broadband speed and download and upload capacity is important. So we have been collaborating to work on that. Those are sort of tried to touch on a fair number of the schools questions. Looks like, Ruben, you may have some thoughts here too.
Sure. Actually, it was related to the question that someone's asked about if children are still getting their childhood immunizations, which I believe is school-related and it's communicable disease, public health-related. And so while all areas initially had reduced their immunizations, we have been ramping back up to ensure that the childhood immunization schedules can be caught up and then actually go on from this point forward, especially whatever mode of school that's going to be in session starting September 8th and going forward. In Virginia, the immunization requirements have not been lifted, whether you're doing it virtually, hybrid, or fully in school. So we are working with our school health staff and the schools to educate parents and remind them that they do need to actually have their immunizations ready. People may go, well, why is that important? One, it just is a way to prevent illness, injury, or death from those things. And to be ready for when schools do come together. You don't want it just to be COVID that they prevent spreading. You don't want children as they come back together to spread vaccine preventable diseases. So this is a very good time to encourage people to make sure their children's immunizations are up to date. You don't want to have to deal with measles and COVID at the same time.
Yes, absolutely. So that covers everybody to this, all of the schools questions, at least that come immediately to mind, except we are partnering and thinking about funding, which we know is a key issue. But Takas, maybe you see a last question and then we can start to wrap up.
Let me just, we talked about schools, we talked about testing. We have almost, I mean, in thematic topics, this is a pandemic that really is, throwing up many balls. So there are so many aspects of our public life affected by the pandemic right now. So we try every week to answer as many questions as they come, but there are also many other ways to contact the Arlington County. Go to the website, arlingtonva.us/COVID-19. There is essential information there, where you can be tested, how you can be tested, what other resources are available, what are the emergency support resources that there are, what are our current data. The team of Dr. Varghese is publishing a fantastic dashboard of information, which I believe is really very revealing, and it basically underlines the constant repetition of that. Yes, wear your mask, wash your hands, have always a mask with you. So that's wear it every time you are outside. I think this is very important, and keep social distancing really religiously. This is really key. This is the only way to flatten this curve. So I would leave that to our county staff if they have any final remarks, and then we can wrap up, I believe.
Sure. You guys, the county staff, each of you have been so helpful, and I think that may cover it. We'll go ahead and close up with a couple of just concluding remarks. I'll start off by saying thank you so much for joining us this week, and share it over with you, Takas. I know that the census is a shared priority of each of us, and you might want a concluding remark or two as we wrap up.
Yes, it was very helpful to be here today for this live update this week. So we encourage, as I said before, everybody to visit the Arlington County landing website on the pandemic, arlingtonva.us/COVID-19 for any additional information. And you can, if you have still additional questions, you can always call 703-228-7999. So 703-228-7999. I wanted to just for a moment, since I have the opportunity to also pause and remind everyone that we're still hoping that all residents in Arlington take the 2020 census. This is really critical for ensuring fair congressional representation. It also means that we get our fair share of federal money. That's about $50 million of federal funding each year. And it's very important for health, transportation, housing, emergency services in our community. Basically, it is money that we deserve because of our size, because of our population. It's very important that everybody gets counted. We are at right now, correct me if I'm wrong, about 73%. So we have still a way to go. It's important that everybody knows and enrolls. The best way to do that is actually to go to the arlingtonva.us website, our county website. You will see there immediately the link to our census page. It's relatively easy to complete these 9 questions and help everybody to be counted, as it is important for everybody's welfare and prosperity as we go forward. That little plug, I would stop here. Matt, if you want to.
Sure, Takis, thank you so much. First, we're thrilled, of course, to have you join the board, and also really appreciate your focus on the census. And I'm happy to be. We're going to an event, the two of us, tomorrow night or Monday night.
Monday.
That's right, Monday night, just to work on getting from 73% to 100%. Want to just touch on another opportunity to make a difference. Many of you have asked about schools. And I know one thing I've seen in the last 24 hours is a way to help students in need and our neighbors who might need a little help with school supplies. There is a Buy a Neighbor School Supplies campaign, which I've chipped in and contributed a little to, and I hope you will all consider doing so too. Through Sunday, August 23rd, for as little as $10, you can support children in need of school supplies. We're working with many great partner organizations, and your donation will help families get the supplies they need for the coming year. To learn more, you can visit Volunteer Arlington website at volunteer.leadercenter.org. So that's volunteer.leadercenter.org. Let's chip in to help Arlington be a compassionate place for all of our students. The virus won't be disappearing overnight. We need to remember to be vigilant, and we've used that word a lot. We have to wash our hands, wear face coverings, and maintain physical distance. We don't want to be like some of the states that have seen huge jumps. That applies in the workplace and in addition to everyday life. You take advantage of teleworking if you can, and be aware of physical distancing if you have to go to a communal workspace or if you're in the community, and as well when you're with friends and neighbors, at the grocery store, restaurants, parks, gyms, anywhere outside your home. Thank you for joining us today. Be safe and be well. And in this very challenging year, let's take care of ourselves and take care of each other.
Thank you.
Thank you.